Okay, well, today we're going to be talking about a very interesting topic. There is not a whole lot of information about it, but I stayed into the scientific world, and that's what I'm going to be presenting. At the end, I'm going to be sharing the references that I use, so you can just take a picture and then just look and read more about it because it is fascinating. We're going to be talking a lot about emotions, traditional Chinese medicine, the connection between organs, energy, and teeth, and the relationship between emotion and teeth. So I believe that your mouth is a mirror of your emotional and your health conflicts. So according to the CDC's National Center for Chronic Disease, there are 6 in 10 Americans live with at least one chronic disease. They are the leading causes of death and disability in America. We as biological practitioners understand the direct relationship between oral disease and then systemic diseases. We understand the connection between oral health and heart disease, stroke, diabetes. We understand the relationship between preterm and low birth babies, and even the links between respiratory conditions, pneumonia, or any other respiratory conditions. So with this presentation, I want to invite you to look at your patients beyond the physical body and just pay more attention to the mental and emotional components that are crucial for the process of the disease. So let's just have a little more open mind when we are looking at our patients. Look beyond that physical body that we are seeing. They're more than that. So I am an integrated dentist. We've been in dentistry for more than 2 decades. I was born in Medellin, Colombia, South America, and I have extraordinary teenage twin girls. I am passionate about bringing awareness to health and well-being by focusing on the mouth as a mirror and gateway to the body. So a few years ago, I had a challenging personal crisis that changed my life and the way I see my patients, the way I practice my career. And I discovered that I could offer more to my patients than what I was doing with traditional dentistry. And it is about understanding that the disease and the conditions of your mouth are intimately connected with everything that is happening in your life, in your body, and then how you experience your emotions. So a toothache, for example, in addition to having a physical condition or a physical reason, we should associate that with your emotions, the situations that you're going through, to an inner balance. I don't know if you have noticed that certain times during the year, we see that the patients come with very similar diagnoses. For some reason, I'm noticing that during tax season, the pain, the toothaches increase. I don't know if you've seen that, but I've noticed that quite a bit. So I got motivated to expand my toolkit and then started a PhD in integrative medicine. And then I did start digging deeper and then went and did emotion and body code certification, did a hypnotherapy course at UCLA. And then I'm currently finishing my dental decoding studies, identifying emotions as they relate to specific teeth. And I am a follower of the PNEI, which stands for Psychoneuroendocrine Immunology. And it was first described in 1936, and it studies the link between psychology, neurology, endocrinology, and immunology. So for me, the disease occurs when there is an imbalance in our body, when the neurological, endocrine, immunological, and the emotional balance have been lost. So let's just do a little exercise and we're gonna kind of wake up a little bit our bodies. So I want you to start rubbing your hands together. So just rub it really, really fast, really, really fast. And then just feel that warmth. Right now, it's gonna take me a little bit of time to warm mine up because it's cold here, but just feel that warmth in your hands. And then now just separate your hands about this much. I want you to notice, do you feel the little tingling sensation on your palms? This can be very subtle. And sometimes it takes a little practice to notice that. So do you feel that little tingling sensation? And then I want you to just try to slowly get your hands closer together. Just try to get them a little bit closer. And then slowly, do you feel a little resistance between, between your hands? Okay, there is a little resistance in there. And then now we're going to do a little bit of breathing. And then you can expand your hands a little bit. And then you will notice that the resistance between your hands increased a little bit. So this resistance here is what we call the electromagnetic field or the biofield. When we look within our body, when we look deep in our body, we're going to find that there are systems, there are organs, there's cells. And then if we use a transmission electron microscope, we're going to see nanoparticles and we're going to see atoms. So our cells have very, very small particles. We have electrons, protons, neutrons, and other fundamental particles within our body. And they're not standing still. They vibrate. So this vibratory motion is going to create an electromagnetic radiation that is emitted. And that results in the biofield or the electromagnetic field. And then when we are healthy, in a healthy human being, we can see that research has found that it can even extend up to 4 or 5 feet in all directions around our body. And then how does that energy move in our body? Well, according to traditional Chinese medicine, and this is what the acupuncturists do, they run through a meridian. A meridian is a pathway. It's just a pathway that runs in our bodies. And it is just like the arteries that they transport blood, but then this pathway, this meridian is transporting energy, and it affects our physiological system. So the human aura, that's also called, the biofield is also called the aura, or the electromagnetic field is the aura. It is unique to every individual, and is affected by the physical, the mental, the emotional, and then the spiritual state of the person. Any changes on that, as we noticed when we were breathing, and notice that expansion of that bioenergetic field, just breathing exercises will help expand that bioenergetic field in your body. So technology has advanced so much, and it keeps advancing. So it's going to get to a point that we're going to have a lot more information about this topic, thanks to technology. There are ways to measure this biofield. When you go to the cardiologist, for example, you're going to see that they're going to do an EKG, an electrocardiogram. And what is this doing? It's measuring that electric biofield of your heart. And then if we go and have an exam on your brain, we're going to get an EEG. And this is going to measure the electric activity of your brain. The electromyography is going to be measuring your muscles and the electric frequency in your muscles. There is a device, if you look on the screen, the one on the right side, that device is called BioWell. Dr. Konstantin Korotkov, he is a professor of computer science and biophysics in St. Petersburg, developed this device, and is a GDV, a gas discharge visualization device, and is stimulated by the electromagnetic field. It shows the energy flow in the body. So Dr. Rubik, he's a PhD biophysics from the University of California, Berkeley. He recorded measurements from people that were doing Qigong. Qigong is a Chinese system of breathing exercises and body movements. And they did record these participants before the exercise and after the exercise. And they notice a complete difference in the results. So if we look on the image, you see on the person that is surrounded by the aura on the left side, you see that there is not complete image. There is some gaps, there is some spaces between the biofield. And that is because there is indicating there is some imbalances, there is some blockages on those meridians that we talked about, or there is the frequency or the energy on the specific organs is not doing okay. There is an imbalance, an energetic imbalance on those. Compared to the image on the right, you see there is no voids. It's very, it's a little bit more uniform compared to the one on the left. There is a video on YouTube at the IAOMT that I highly recommend you watching. It's Dr. Jerry Tennant's. He did a presentation about the energy. And then he says that the body is an electronic device which has multiple battery packs. And the chronic disease occurs when those battery packs won't hold a charge. So basically, if we are having a chronic disease or if we are having any disease, that means that the energy in certain part of our body is not ideal, is not optimal. There is another devices that you probably have heard is the PEMF, that stands for pulse electromagnetic field. We understand and we know that, for example, the frequencies from the electronics from our cell phones or from power lines are not beneficial for our health. But when we use a low frequency, like the PEMF, low intensity, is going to be creating a cascade reaction in our body. It's going to start balancing those energies in our body. And it's going to have a lot of amazing benefits. Bassett in 1955 talked about it and how it can start changing the cell, the nucleus, and even go to the level of the genes. There's quite a bit of studies about this, the PEMF, and there are more coming out because the results are incredible. So let's see, how can we determine if the cell or our body, our biofield is healthy? Well, the normal frequency range for a healthy human being, it's around 62 to 68 megahertz. So the cells, to be able to be healthy, they need to have a range of a pH of 7.35 to 7.45. But what is this pH compared to the energy? Well, pH describes the voltage in water or in a liquid, basically. So if we transform the 7.35 into volts, we're going to see that is a minus 20 volts, millivolts. And then the 7.45 is minus 25. So a healthy cell is between minus 20, minus 25 millivolts. But for this cell to be able to make new cells, it needs to be minus 50 millivolts. So we start having a little idea of, okay, what is it the ideal for a cell? And then we can start adding that up into like the organ. What is the ideal for an organ? Then the system needs to be running at this ideal frequencies. So the device that you see on the bottom, I don't know if you use that, but it's called the Alpha Steam. And we use it a lot in our office for patients that are having anxiety. It uses cranial electrotherapy stimulation with a low level electrical current at 0.5 hertz. And it is applied to the head for therapeutic purposes. So they put it on the earlobes and then it starts emitting frequencies. So what it does is just in training the brain. The alpha steam stands for alpha brain waves. The alpha brain waves are associated with relaxation. And then it's just like when people are doing meditation, the alpha brain the alpha brain waves are going to be a little bit more calm, and that's going to be activating those. So then if you have an EEG, for example, then you're going to be seeing that those alpha brain waves are going to be more active. Right now, we're all using more of our beta brain waves that are a higher range of brain wave. The alpha is around 8 to 10 hertz. And then what happens is that when that electromagnetic field sends that range of frequency, the brain is entrained and adapts to those frequencies. And the person goes into a psychophysiological state of relaxation. with about a session of 20 minutes with this alpha stim, you're going to notice a significant increase of the alpha brain waves. Dr. Jerry Tennant, again, in his book, Healing is Voltage, he says that chronic diseases have a low voltage. It turns out that when a chronic disease occurs, when you lose the ability to make those new cells work. There's some studies also that found that using PEMF can help you with different parts of your body. So Dr. John Zimmerman did a study where in 1995 was reported by Siskin and Walker, where he used 2 hertz and he was able to achieve some nerve regeneration by using 10 hertz ligament healing, and then 15, 20, and 72 hertz will cause stimulation of the capillary formation and fibroblast proliferation. So it is really recommended, and we use it a lot with our patients that are very anxious to use. At least the alpha stim is easy to use. There is no side effects. So just highly recommended. Because that we know that the low frequency of the electromagnetic is going to be having some changes in our body. There is incredible benefits from the PMF, but if you're going to look for a device, I highly recommend you to look for something between 1 and 30 hertz of range, because you don't want to go too far above. Beta brain waves are between 14 and 50 hertz. And then we know that those are the ones that stressed out a little more the brainwave. Those are the ones that are keeping us alert and paying attention to what I'm saying here. So this is something that I'm really passionate about, and it's PENEI, that stands for Psycho-Neuroendocrine Immunology. And as I said, it's first described in 1936, and is studying the interactions between the psyche, that's the P, the nervous system, that's the N, endocrine, and immunology. So it studies the responses of all these interactions, all these systems together. If something is wrong with your psychological state, your systems, all the other systems are going to be affected by that. So changes in the immune and the endocrine system are going to have changes in the nervous system. Changes in the nervous system is going to lead to changes in your emotions. And then also, Jerry Tennant's talked about that emotions are magnetic fields and they can block our meridians. So if we are having an imbalance, an energetic imbalance in our body, in one of our systems, we will see that because they're all connected, if there is a blockage, for example, in your house, if you start plugging in all your electronics in the same side of the house, you're going to have a break, like a outage, because the breakers, that's kind of the control system, is going to say, this is too much. We're going to have to cut the energy. So something like that can happen in our body. If there is too much energy going in one area, and usually emotions can be causing this. If we are dealing with difficult emotions for a while, then we're going to be seeing changes in our body. So from that emotional state, we can start seeing physical changes. For example, let's just do a little exercise here and see how they are connected. So I want you all to start thinking about a lemon. And you're going to be just visualizing this lemon, this beautiful yellow color, and you can get it closer to your nose and you're going to smell it, feel that scent of the lemon, that citrusy scent. And then you're going to be imagining that you're cutting that lemon in half, and then you will see the juice of the lemon coming out of it. And then the scent is going to be more intense. Then the more you start visualizing, connecting with this image, you're going to start noticing that your mouth is going to be salivating a little bit more. So this is very interesting, something that we're just thinking about, just a thought. created a reaction in your body. Same thing when we are having fear, for example, and we're thinking about talking to our boss that we want to raise, or we want to have this new device because we know that is going to be benefiting our patients, but this boss, it doesn't want to spend too much money. It's like, okay, how am I going to tell him I want this device? I want it because it's going to be benefiting my patients. But then you start having like a movie in your head, and then your heart starts getting, it's just, you're accelerated, you're hyperventilating. It's like, what am I going to say? What am I going to do? Or how many times we had sleepless nights thinking about something that we're worried about. It is all in our head, but our body is reacting to this. Now we are seeing that our psychology, the P on PNEI, is affecting, and that is including our thoughts and our emotions, is affecting our body. Dr. Candace Pert, she's a PhD and American neuroscientist and pharmacologist. In 1973, she discovered a molecule that is found in the surface of all the cells in our body. And then this molecule, or with this study, she found that our internal chemicals, our neuropeptides, and their receptors are the actual biological foundation of our awareness. They're manifesting themselves as emotions, beliefs, and expectations, and they influence our response to an experience and how we experience our life. So if we look on this little diagram, you can see that there is a cell, and then the little green areas, those are the receptors. And then the red circles, those are neurotransmitters. And then we can have different ligands that can be neurotransmitters, that can be hormones, peptides. But the thing is that, remember we talked about like every single part of our body, all those little atoms, all those little nanoparticles are in constant vibration. Well, there is the same situation with the receptors and the ligands or the neurotransmitters. They need to be vibrating until they find the right receptor, and then they match. So then when that happens, the receptor site is going to open up, and what's going to happen is that the message that this ligand is intending to give to the cell is able to go through, and those are the little dots inside this neuron that are green. So that's when things start happening, and that's when our body starts creating the changes that need to happen according to the ligand or the neurotransmitter that was there on that receptor site. So there is signals that are constantly happening between neurons and cells throughout the body, and they are important to regulate our mood and our emotions, as well as regulating our sleep and appetite. So just think about all those nights that you couldn't sleep because you were worried about something. That's because maybe those receptors were not having the right vibration, they were not connecting, and then we're not receiving the right message. According to Dr. Pert, 98% of the information and data transfer occurs at the receptor site right there. And only 2% happens in the synapses of the brain. So we have about 70 trillion cells in our body. Imagine that every single one has receptors that are accepting those different neurotransmitters or these ligands that can be peptides, neurotransmitters, hormones. And then they are just sending the information that we need to this specific site and then to the brain. Recent findings support the theory that memory is stored throughout the body, not just in the brain. So every single part of our body is storing some of the memories that we have. And that is also including our conflicts, our emotions. So our emotional state dramatically affects how or if there is a connection with the receptor and the ligand. now we're going to just, I want you to remember this. We're going to go back to this because we're going to be applying that into what we love, and that's teeth. But before that, let's jump into what traditional Chinese medicine says about emotions. Traditional Chinese medicine is having theory about emotions for over 2,000 years. They say that the emotional changes lead to specific diseases. And then some diseases may result into emotional changes. It can be both ways. But if there is an emotional change, for example, anger, if you're sad, if you're afraid, so those different emotions can be causing an imbalance in your system, in your body. And then remember, let's talk about the meridians. The acupuncturists, that's what they use. They use these meridians. And if there is an imbalance in one of the organs, they're going to go to a specific meridian. Your liver could be the one that is having an imbalance, and they're going to go and put a needle on your hand. How is that going to be benefiting our liver? Well, because there is a meridian, that pathway, that network connection that is sending the signal to that part of the body that needs to be imbalanced. So then the other thing is that in the year 900 to 1200, Cheng Wuzi proposed the concept of their 7 emotions. Those are the main emotions according to traditional Chinese medicine. And they cause changes or disharmony in our internal organs, even to a state of YU. And that basically means there is a blockage, or there is entanglement, or there is a clogged area in the meridians. So when we look at the image in there, we can see, for example, the heart. The heart meridian will be leading the heart. You can see there's 2 organs on that. And it's usually because traditional Chinese medicine uses the law of the yin and yang. So they use a hollow organ, which in this case will be the intestine, the small intestine. And then the heart is a full organ. So they are a couple together. So they are opposing each other, but they are a couple. They work in sync. So usually if we have problems with our gut, we could be having problems with our heart. And then the emotions that are associated with the heart are hate and impatience. And then when we have a spleen, it could be worry and anxiety. The lungs are associated with sadness or depression. My dad passed away 18 years ago. And when he died, my mom, every time I asked my mom, how are you doing? Oh, I'm fine. Everything is fine. So she was not dealing with her grief. And then she developed a lung tumor. They did a surgery, they removed that. But then when I took her to the traditional Chinese medicine doctor, he was saying that the lung, that tumor was originated because she didn't do the grieving of the death of my dad correctly, because she was containing that energy. Emotions or energy, if we contain them, they're going to go and stay lodged in one part of our body. So it will create a blockage on the meridian that is running through that organ. Now let's just get to the really fun part, is the connection between the teeth and the internal organs. So Dr. Reynold Ball and Dr. Kramer in the 1950s, about 70 years ago, they investigated the energetic links between the teeth and the paradental tissue and the inner organs. They performed bioelectrical measurements while they were drilling teeth. And these measurements, they were applied to traditional acupoints, whose connections were connected with the inner organs, and these functions are well defined. So according to Dr. Ball's findings, there is a mutual correlation between the respective teeth and the meridians. There is a different energy charges of the different organs that is produced by the reaction in the teeth through a specific meridian. So the mouth is basically a microsystem. I don't know if you're familiar with the microsystem that we have in the ear, and that's how they do auriculotherapy. because there is a representation of all the organs in the ear. And then there is a microsystem in the mouth. They were using electrostimulation to activate different meridians. So when they were doing a palpation on the buccal mucosa, there were certain areas that were a little more tender, a little more sensitive, and those areas were associated with specific meridian. So they just connected the meridian that is associated with that specific tooth, and that's how the oral acupoint started happening. So that's how they started using the electrostimulation and helping patients that were having systemic problems through the buccal mucosa. So the emotional state of an individual depends on the smooth flow, according to traditional Chinese medicine, of the smooth flow of their energy in the blood. For example, the liver for traditional Chinese medicine, it's very important and is the one that is going to be helping and guiding. It's kind of the director of the orchestra of the compared to the other organs. So if there is something going on with the liver, if the energy is going to be stagnant, you're going to see that this person is going to be more irritable. There's anger, they get angry very easy. So we see when the patient is liver deficient that they're more susceptible and they get really irritated really fast. So remember I told you to just kind of have that idea of the receptors and the ligands, because we're going to be connecting those with our teeth. There's a book that I highly recommend, and is the Dentinal Fluid Transport by Clyde Rogenkamp. He compiled the studies of many, many years of Dr. Steinman. He was a dentist, and Dr. John Leonora, he was an endocrine physiologist. They started working and trying to find out what's going on with the dentin and the odontoblast and what's happening. Does the circulation stop at the pulp? Is there anything happening beyond that? And they found that there is something that they call the dentinal fluid transport, or DFT. And it's also referred as like the dental lymph. So what they did is they study rats, and they study pigs, and they use a fluorescent dye in their studies, and they found that, for example, and this is very important, if they were feeding them the right diet, the non-cryogenic diet, what was happening with that fluid? Was it stopping at the dentin, at the pulp, or was it continuing? Well, they found that the right food, and then they put this dye on their rats. They found that from they feeding the diet, the dye went to the pulp, but then within 30-45 minutes, it went from the pulp to the dentin, to the enamel interference, that interference between the dentin and the enamel, within 30-45 minutes of the rats that were fed a non-cryogenic diet. But this didn't happen with the rats that were fed a cryogenic diet. With those, it didn't penetrate beyond the pulp. It just stayed kind of in the pulp, and it didn't go beyond that odontoblast layer. So why is this? Well, let's think about that. Cryogenic diet has a low frequency vibration. If everything, according to quantum physics, it's energy, if you eat sugar, your energy is not going to be as high. Well, maybe temporarily, but not for a long period of time. But if you eat something that is more nutritious, then the energy, the frequency of your energy is going to be higher. So a patient that can continuously eat healthy food is going to be on that range of the 62 to 68 megahertz of the biofield. But if we see a patient that is eating just McDonald's, there's a low frequency vibration food, is not going to be having the same biofield, the same healthy biofield. So why is this important to us? Well, if we see that connection of the cells on the membrane of the cells, then we see the odontoblast. If the connection that odontoblast is receiving the different receptors. So there's some hormones, for example, the happiness hormones. And then we see the dopamine. It's a neurotransmitter, but it's also a hormone, and it makes us feel good. It's the feel good hormone. Then we have the serotonin that reduces the depression, and then the endorphins that also make us happy and reduce physical pain. Well, there is new research now that they have found that dopamine in the pre-odontoblasts and odontoblasts might promote odontoblastic differentiation and dentinogenesis. So just think about that. We have the membrane, we have the receptor. If this receptor is receiving this neurotransmitter dopamine, there is a possibility that we're going to be able to have dentinogenesis where there is a problem. And that DFT, or dentinal fluid transport, is going to be functioning correctly, just like the rats that had the non-cariogenic diet, where the dentinal fluid was going up to that connection, that interface between the dentin and the enamel. And then the other interesting research is that essential roles of dopamine and serotonin receptors can help with tooth repair, and it is related with that dentinogenesis. So it is fascinating that our teeth can be influencing our body, and then our body is influencing our teeth. So the dental infections can be a significant problem because each of them are connected with the circuits that run through a specific teeth or specific meridians. So I believe that probably you have seen this chart. This is an incredible chart that has been compiled for many years, and then they're using the results from Dr. Voll and Dr. Kramer's, and also the connection with traditional Chinese medicine. So each oral acupoint corresponds not only to one single organ, but to a specific range of groups of organs or group of organs. So we can see each group of the teeth. If you look at the incisors, for example, they are sharing the same organs. And then we have that the incisors, upper and lower, are connected to the kidney and the bladder. Then when we look to the canines, upper and lower, they are connected to the liver and the gallbladder. Remember that there's two organs in there because traditional Chinese medicine using a couple organs that are yin and yang energy. And then if we look to on the premolar area, there is a little switch because the meridians on that area, the meridians that run on those are switched. They do a little switch. And then so you can see on the upper right side of the premolars, and we have the large intestine and the lung, and that is switched with the molars on the lower. And then the same thing happens on the other side. And then the wisdom teeth, that's something really interesting. The wisdom teeth that are usually either missing or they are removed, they are connected with the heart, and they are connected with small intestine, and they are also in charge of circulation and the endocrine. So a lot of people are struggling with endocrine problems, hormonal problems, especially now. The cortisol is usually going higher, and it's associated with, let's go to the PNEI, and we have the psychological, emotional, the stress after going through a pandemic, for example. Then we start having our sympathetic nervous system more activated. Then our hormones start having some challenges. And then down the road, if all this is not improved, if all these energetic pathways are not improved, we're going to have some problems with our immune system. So it is really amazing how I start asking patients that come to the office, oh, I have a toothache here. And then I just look at the connection with the emotions, and 95% of the times there is a conflict going on, or they just passed a conflict just a week or so ago. So I want you to, and this is what I want you to start kind of looking a little bit more, because you will be helping your patients not only by the physical body helping them with the teeth, but psychologists say once you have something that comes from the subconscious, Dr. Carl Jung talks about this, then if there is a conflict in the subconscious, we tend to block those memories. And if we can bring something to the conscious level, healing can start happening. So we can be helping our patients become a little bit more aware of their emotions, become a little more aware of their conflicts, and making them just look at this chart. It's like, I want you to do a little introspection and see if there is a conflict or if there is something that can be associated with what's happening here. Because this tooth is running in this meridian and is usually associated to these emotions. So we currently doing more research regarding this topic, clinical research, and just trying to see if there is more technologies that can prove this. Because traditional Chinese medicine is mainly based on observation and experience, and the Western medicine is basically relying on scientific investigation. So everything I talked about today, it's in these references. You can take a picture if you want, or you can ask Barbara and I can gladly provide you with the information. And I want to thank you all for being here. And I want to just leave you with this last slide. Let's together promote a culture of biodental health. We need to increase the awareness. And we are going to be helping the patients in many ways if we start using the biological dental health awareness. Good, thank you. So I'm going to stop sharing. And then we have a few minutes. I'm sorry I went a little bit over. I could spend the whole day talking about this.
Well, thank you, Isabel. That was wonderful.
My pleasure.
Anybody have questions? We've got a good 15 minutes worth. We can chat.
Yes, Tara, you can unmute yourself.
I just had, that was wonderful. Oh my gosh, thank you so much. You mentioned a book that talks about the dental fluid transport. Who is the author of that? I wanted to look that up.
Doctor, he has a really long Gauguin kit. Do you have it in there?
Or even if it's just the name of the book.
Is it dental fluid transport?
That's the name of the book. Dental. Yes. Okay. Yes. Okay. Perfect.
It's a compilation of the studies that Dr. Steinman did.
Okay.
So you can just Google dental fluid transport. Actually, I ordered it through Amazon. I got it through Amazon.
Okay.
Amazon has it.
Wonderful. Okay. Thank you so much.
Yes, it's Gauguin Camp, I believe is the last name.
Okay.
Mm-hmm. You're welcome. It is amazing. And it has all the studies that they did. But this information with the dental fluid transport is just incredible.
If a tooth's been extracted, what does that do to the emotions?
Okay, so if I put my quantum physics hat, I'll tell you energy is there. There is actually several studies, and I was going to put the slide with this, but I said, no, maybe not. Maybe for another opportunity, because it will take a little bit of time. So they have done some studies with, I don't know if you're familiar with Kirlian photography. It's just, it analyzes the photons and the energy in any organ, in any body, and any object. So they use it mainly, they use it with a leaf, for example, where they cut part of the leaf. And they did they took a picture with this curling device. And what happened is that, so it showed the energy of the leaf that was intact, but then it showed a holographic reflection of the leaf that was cut. So if we're talking about energy, if we remove a tooth, if it was because there was an infection, we're clearing that blockage on that meridian. But if it was removed and there was no problem, then and even if it's removed because of infection, that energetic part of the tooth can be there. So it is benefiting the blockage because you're removing the problem. You're removing all that negative influence of the infection or the problematic tooth, but the energy of that tooth is still there. So the meridian can be flowing without any problems. So there is no blockages if you do that.
Thank you.
But if I use my dental decoding hat, there is a lot of information that talks about your emotions. That's something that I'm researching, and we need a little more scientific backup. So in the future, we'll be talking a lot more about that.
Interesting.
I think there's some questions in the chat. Yes, the research was for Loma Linda University. Sonia says, thank you. I have been practicing since 2010 in my dental hygiene chair. It's so refreshing to hear you speaking the same languages. I'm glad we are speaking the same language. Our dental practice is in Edmonds, Washington. It's Green City Dental. Barbara, Bona, and myself were there. And then Dawn, if all the dead tissue is removed, the energy can go through unless you place an implant. Well, this is a really interesting question, Dawn. Depending on the implant. If it's a titanium, it's gonna block that meridian. If it's a zirconia implant, it's more biocompatible and it will allow the energy to flow. Says concert pitch was changed in the 1940 to 440 megahertz or millihertz to 432 to cause disease. Well, thank you for bringing that up, iPhone 7. As I mentioned, and everything is energy, music, frequencies are energy. There is actually something that we use to entrain the brain, and I don't know if you've heard of binaural beats, where you have a specific frequency on the one side of on one ear, and then you hear a different frequency on another ear. And then what happens is that the brain tries to mimic those different frequencies, just what the alpha stim did with just trying to get more alpha brain waves. With this, you can just start achieving whatever you want. So there are binaural beats, depending on the frequencies, that are going to be helping you stay more focused, for example, just because it's going to activate those beta brain waves, or it's going to give you a little more relaxation that is going to be activating the alpha brain waves. So depending on the frequency that you apply, that's what you're going to be getting. That's the vibration that you're going to be feeling. And then that's why when we are listening to certain music, we get like a little agitated, and it's like, it gives us a different vibration, a different frequency, because our body is trying to coordinate with this frequency. It's trying to kind of vibrate at the same frequency. And there's some other music that is going to calm you down. It's also associated, if we think about PNEI, what are your past experiences with certain things? So we all respond different to different things. Our brain, the electric part of the brain, is going to try to regulate and train to these frequencies that we're listening to. But also remember that the psychological part of us has memories from the past. So for example, somebody that had a past experience that was traumatic, seeing something or while he was listening to a specific song, then this other person is going to have a different response by listening to this music. May I ask, which zirconia implants do you like to use? The majority of the zirconia implants are good, except, and I don't remember the brand, but there is one that unfortunately the screw that we use or they use is a metal, so it doesn't make sense. You have a zirconia, beautiful zirconia implant, you have an abutment that is zirconia, but then you have a screw that is metal. So I don't like those. What I use is Sarah Root implants. It's just one piece, and I'm gonna plug my computer because the battery is dying. So I use cedar root implant. There is one piece, so implant and abutment together. I love the way the tissue, and Barbara and Bona will love the tissue around those implants because it's beautiful. Usually when I removed an abutment from a titanium implant, the tissue is really irritated, is red, and is bleeding. With the zirconia implants, especially with cedar root, the tissue is just beautiful. So those are the ones that I use. Okay, very good. Any other questions?
So I have a question actually. The exercise that you had us do, like rubbing our hands and feeling the energy between our hands. I'm really new to energy healing. But I just wondered if you do any of those, any practices on with energy healing with your own energy on your patients.
Every single day.
Okay.
I've been doing it. I'm a Reiki master, and since I did my training, I do it every single day with my patients. They don't know, but they don't need to know.
That's what I was going to ask you is, do you get consent or you just transfer that energy yourself?
And you all are doing that. Believe it or not, we all have the ability to do it. Just having that intention, having that loving, passionate, if we are here, it's because we love what we do and we care about our patients. So just by transmitting this to your patients, they're going to receive that. Remember, the biofield goes about 4 or 5 feet wide. When we are with a patient, that biofield is integrating. We're integrating that biofield, their energy with our energy. And that's why some of our patients, they drain us. They're like, oh, I just need a nap after seeing this patient. It's just because we are so close together that biofield is we're just sharing that space. So if you send them love, if you send them all this amazing frequency, and actually the HeartMath Institute has been doing a lot of research with the electromagnetic frequency of the heart. And they say that the heart frequency is, I don't remember exactly how many times, but is a lot more times stronger than even the electromagnetic frequency of our brain. So if you just love, it's the highest frequency that you can give your patients, so they will receive it. You don't need to have any training for that.
Okay, thank you.
Yeah, and then that's a good thing that you asked, because I want to know if you guys had the experience with
Absolutely.
the resistance. When you rub your hands, there are some energy centers in your palms, in the palms of your hands. So that is activating a really, really strong electromagnetic field, the electromagnetic field. So then, and you can just practice it by breathing. You're going to be expanding your energy field. And that's why a lot of the times, if we're anxious, what do they make us do? Just breathe, because the breath is just amazing to change our energy, to transform our energy. Okay, Sonia says, we say it's universal Emery. Sonia, do you want to open your mic and...
Hi, thank you so much. So since 2010, I found a biological dentist that was open to everything that I've wanted to do. And so we get patient consent, and we start with a guided meditation that connects our patients to the present moment, to the teeth and the mouth. And it's interesting because when the patients are present, they have been more keen on listening and caring and actually taking action in, doing their morning and evening oral care routines. And then they get more connected, and they want to hear and ask more questions in the dental chair of patient education, which is awesome. So I'm a Reiki master, and since for I think maybe over 25 years now. And so we do, we call it universal energy. We're not allowed to use Reiki in the chair. So it's life force. It's your life force. It's your prana. It's your breath. It's your energy that's moving through your meridians. And we're connecting through that. And what I've noticed is the teeth also over the years, the teeth hold memory, as you were saying, just like our muscles. You go for a massage and you have these breakthroughs and you start crying because the teeth hold memory in the teeth. So as we're scaling, we also do like positive affirmations. And so with each scale, we're not just removing, the debris or the bacteria, but we're also clearing energy as well. And then the patients are saying they're positive, or I'm repeating a positive affirmation or a mantra as it goes through. And then we also do, like, I have a smudge spray, and we also do sound healing. So I use like tingshaws and a Tibetan singing bowl at the end. And and so I created it for me.
That's amazing. I love that.
And at the end of the appointment, like, they're just in awe, and they love it. And we get patient consent, and we use all of my Nirvana Dental Apothecary's biocompatible oral care products in the chair as well. And they just see how the teeth are connected. It's the experience.
Yes.
Yeah.
So
thank you.
It is. You might want to look into, actually I didn't pause on one of the slides where I've been working with a acupuncturist, and we created a company. It's called Isa Misu. Is the first three letters of my name, ISA. Misu is the last letters of his last name. His name is Dr. Chimisu. So Isa Misu with Z. And we talk a lot about this on our YouTube, and we constantly have workshops and conferences about this. And you will be interested to look at our YouTube. There is a doctor from France. He's a dentist. And there is another doctor, he's from South America, that has been studying emotions and connection with teeth. I would love to talk about that at one point, but as I said, the science is not there yet. I'm wishing for the science to catch up, because I've seen patients cry every single time I ask them, are you having a conflict with this? And they say, and tears start running down their face. I say, yes, how do you know? Like, your teeth are just telling me that. So it's fascinating. I want science to just move a little faster.
May I comment on that?
Yes.
Yeah, well, that's the thing. When you explain to the patients the emotional connection, and then that's when we go the extra step to try to reprogram so this is what's happening as the polarity, and then we create that positive. So they go in and then they neutralize, and they use their oral care as a time to really empower themselves by creating these positive affirmations, these mindsets. So it's amazing. Like, I've had lots of patients cry, and it's like, okay, you're crying, but what can we do now? We'll fix your teeth. And it's almost like we're a life coach using the energy of our teeth, right?
Absolutely.
It's so amazing. Yeah. Thank you so much.
Thank you, Sonia. Thank you.
All right. Well, Isabel, that was amazing. Thank you so much. I appreciate your time and enlightenment. And I knew this would be interesting. So, and I just am so honored to work with you, and I hope that we get to do this again down the road. So everybody, thank you so much for coming. And if you have any more questions for Isabel, you can message me, and I can certainly get them to her. And I look forward to seeing you all next month, and we'll talk about the microscope and how to use that. And any questions, let me know and we will address that. Any further questions, send me a message, and we're good for today. So thanks, guys.